It's Ron Burgundy here.
And I'm Brick, and this is Channel 9 News.
We have some good stories for you tonight. We have Alaska flooding, Indiana flooding, and some Africa flooding, and an outbreak at Twin Lakes Secondary School. What is this outbreak, you might ask yourself? It's VRE.
VRE is a type of bacteria that has developed a resistance to especially vancomycin. Enterococci bacteria live in our intestines and on our skin, usually without causing problems. But if they become resistant to antibiotics, they can cause some serious infections, especially in people who are ill or weak.
These infections can occur anywhere in the body. Some common sites include the intestines, the urinary tract, and wounds.
This bacteria is spread by person to person and object to person.
Stay tuned for a conference with the city councilor, a scientist, and a physician.
Welcome back to Channel 9 News, and I'm Brick, and this is
Ron Burgundy, and we're here live from the scene of the outbreak at Twin Lakes Hospital. We've got Danny here, and we're going to conduct an interview. What are you doing? Oh, sorry. Brick. Okay. Danny, how do you feel with this outbreak?
I think it's a serious issue.
Why would you think that? Do you fear it's going to spread somewhere else?
Every night.
Thank you, Danny. I appreciate your time.
Well, that is Danny Webster, reporting live from the Twin Lakes Hospital.
Hello, we are here today to talk about VRE. I'm the city councilor, The Rock Jr.
This is Dr. Doolittle, and I'm the scientist, Alberto Einstein. So, Dr. Doolittle, how does it cause disease?
Okay, so it's transmitted by direct contact, and it spreads within healthcare faculties from bacteria on the worker's hands, and then after that it can be passed on from patient to patient.
Okay.
And what are some of the symptoms?
Okay, well, if VRE is causing a wound infection, that area of your skin may be red or tender. And if you have a urinary tract infection, you may have back pain, a burning sensation when you urinate, or a need to urinate more often than usual. Some people with VRE infections have diarrhea, feel weak and sick, or have fever and chills.
And what is the treatment to get rid of VRE?
People with colonized VRE do not need treatment, but usually people or patients are prescribed antibiotics to get rid of the infections. Doctors usually find out the kind of antibiotics the patient needs by doing laboratory testing like blood tests and urinary tests. Since enterococci is gram-positive, which means it's easy to get rid of, also if a patient has urinary catheter in, usually by removing the catheter, the infection will go away.
So, who is at risk for VRE?
Patients that have abdominal surgery recently, people who have been on antibiotic vancomycin, people with weak immune systems, people who are colonized with VRE, and patients that have medical devices in them like catheters.
Thank you, Dr. Doolittle.
So Alberto, what evidence is there that VRE is actually a problem?
Well, there are a few studies conducted throughout the world. One of them in... Sorry. Okay, so one of the studies was in 2009 to 2015, and they were seeing how many blood cultures of VRE, whether they were like increasing or decreasing, and they noticed the study increase from 2009 to 2015 in Ontario alone. This causes a major problem because it means that VRE is more prevalent in Canada. There was also a study conducted in 2002 by scientist Robert Patel. It stated that VRE is a major problem in hospitals. There are reports of VRE colonizing organs during transplants, and this is a problem because VRE is antibiotic resistant, so it possesses the problem if we would be able to handle it, or whether it could take over the organs, make them potentially useless.
And how does it spread?
The most common ways VRE spreads is person-to-person contact, or object-to-person contact, or if you touch contaminated objects. And this is the Rock Jr., the city councilor.
So Junior, what can you do when you have VRE symptoms?
If you have these symptoms, you can go to your doctor or you can go to the hospital.
Okay, how is this outbreak going to be dealt with?
Well, patients that have VRE and are placed that are in a hospital, they will have their own rooms and their own facilities, like their own washroom and everything. On their door, they will have a little note saying that there is a bacterium in this room, and it is also staff that work at the hospital it'll be mandatory for them to wear gloves and gowns and also a mask. Visitors will not be allowed in the rooms until the disease is gone. Also, for the patient, they will be put on antibiotics to get rid of the bacterium.
Okay, so how can we prevent the spread of VRE in health centers?
Well, as I said, staff will have to wear gloves and gowns when they are caring for the patient that has VRE. They will have to leave when they leave the room, they will have to dispose of the glove and gowns and wash their hands immediately so they do not spread the bacteria. Also, when caring for any patient, they will have to wash their hands before and after. And the equipment in the room, or that is transported in the room, will have to be cleaned thoroughly.
Okay, how can we prevent VRE at home?
Well, we can start by washing our hands regularly, especially after using the washroom and before eating or touching food. If you have an open cut or wound, make sure you clean it very well. And make sure your house is clean and you clean it thoroughly to disinfect everything. Limit yourself to sharing things with other people.
Thank you, City Councilor Rock Jr.
Welcome back to Channel 9 News, and I'm Brick, and this is Santa's Little Helper. We're here to talk about his concern about the outbreak.
So, Santa's Little Helper, what are your concerns about this outbreak?
My concerns are that I'm very upset right now because some of the elves in the workshop already have VRE, and I'm afraid Christmas might be cancelled. And the workshop is very limited staff right now, and I'm just not a happy elf.
That is very sad. Setting, you guys heard it here first from Santa's Little Helper.
Not Merry Christmas.
I'm Brick, and this is Ron Brigandy, and this is Channel 9 News signing off saying,
It's time to see a man about a horse.
and I hope you all have a Merry Christmas.
I'll give a little bit.